Today we're going to talk about dry skin and how it can sometimes lead to eczema. We hope you find this tutorial helpful. Okay, well, let's get started in our discussion about dry skin and how it can sometimes lead to eczema. Well, dry skin, in medicine we call this xerosis or asteiatosis. Well, what happens with dry skin? Why does it happen? Well, with loss of moisture and loss of the barrier oils in our skin, this leads to cracks in the skin at a microscopic level. So it's kind of like a dried riverbed. And over time, when your skin is dry and cracked, it will become very itchy, which leads to scratching, of course, and increased scale or flaky skin, which can then lead to eczema. Here you can see an illustration of how xerosis, or dry skin, over time is the pathway to eczema. So we start with dry skin, as pictured, and then over time we itch our skin, which then leads to these, in this case, coin-shaped patches, what we call nummular eczema. So other contributing factors, well, genetics. So you could be born with a tendency to have dry skin, and that condition is called atopic dermatitis or infantile eczema. It usually comes on about 3 or 4 months of age. An infant will start to scratch. There are several other inherited cases of dry skin. Medical or metabolic disorders such as thyroid disease, certain medications can give you a tendency to have dry skin, and weight loss. Excessive weight loss can also cause dry skin. Environmental exposure is one of the common causes of dry skin. So often we're doing it to ourselves. Harsh soaps, very fragrant soaps can lead to dry skin. Household cleaners can lead to hand dermatitis. And dry weather, lack of humidity in the air, can lead to dry skin. And being in and out of water, especially hot water, can dry out our skin and strip away the barrier protective oils. Aging, well, over time our oil glands start to lose function. It doesn't matter how much water we consume or how much oil we consume, it's not going to come out on our skin. This has to be applied topically. So consumption of excess water or excessive amounts of oil will not lead to moisturizing of our skin. Well, let's take a look. Genetics. Here a baby has atopic dermatitis, and you can see some scabs on the face from scratching, and that's a genetic type of dry skin. And another type is keratosis pilaris. Often babies with eczema will have this condition called KP, or keratosis pilaris, and you can read more about that on our website. Well, thyroid disease or weight loss, these are some medical and metabolic reasons for dry skin. Medications like calcium channel blockers, which are blood pressure medications, those have been shown to lead to eczema and dry skin in more cases. And it's been shown in one article that 68% of patients that had eczema and were on calcium channel blockers, when this medication was discontinued, their eczema resolved. Environmental, again, this is one of the more common things we see, is that harsh soaps when bathing will lead to dry skin. Household chemicals and cleaners will lead to hand eczema, and being in and out of water, especially hot water, frequent hand washing or frequent bathing or hot tub use or excessively hot showers can lead to dry skin. And a note about lotion. Well, creams or ointments are going to be much more moisturizing than a lotion. And you want to avoid fragrance when your skin is very dry or irritated. Here we see someone washing their dishes with gloves. We always recommend that if you have hand dermatitis. Well, I hope you found this tutorial about dry skin and eczema and some of its causes informative.